Hello, everyone. Thank you for joining us today as we talk about men's health. This month is dedicated to men's health, particularly in regards to prostate health. So we're excited to delve deep in with Dr. Vinny here. So first of all, a little introduction for Dr. Vinny. Dr. Leonti's story began with a childhood dream of becoming a doctor. His career path zigzagged between family medicine and emergency medicine, but it was his passion for building close relationships with his patients that guided him towards family medicine. However, life took an unexpected turn when Dr. Leonti, a seasoned marathon runner and advocate for a healthy lifestyle, confronted his own health crisis. A routine run revealed chest pain, and a cardiologist diagnosed him with significant blockages in his coronary arteries. This pivotal moment pushed him to reevaluate his own health practices and habits, and his transformation did not end there. His daughter Jenna introduced him to the world of functional medicine and integrative medicine. And functional medicine, with its focus on addressing root cause and preventing chronic illnesses, resonated really deeply with his medical philosophy. So, inspired by the shared belief of the power of functional and conventional medicine, Dr. Vinny and his daughter Jenna joined forces to create Princeton Integrative Health. Today, Dr. Vinny isn't just a medical practitioner, but also a passionate advocate for the integration of functional medicine into the traditional healthcare landscape. And one of his main passions is improving men's health. So, in honor of men's health, we're going to talk about the ways that we can support healthy functioning. So, thank you, Dr. Vinny, for being here.
Well, thank you, Kayla. Thanks for that introduction. Just wanted to make sure everybody took notice of the beard. It's No Shave November to bring, you know, awareness to Men's Health Month. Men tend to, I believe, more than women. I think the studies show tend to put their health on the back burner. So we're trying to raise that awareness and try to get more men to take those preventive steps that are so important.
Right. Yeah, all of us at the office have been enjoying to see the progression of your beard, and it's definitely important to shed a spotlight on men's health, as you said, um, to help encourage men to take priority. So, starting off on that note, what should men know about prostate health, and what are some proactive steps men can take for particularly cancer prevention in their daily lives?
Sure, prostate health is, I think, seems almost synonymous with men's health. Obviously, there are a lot of other issues like heart health and that kind of thing, which we'll touch on. But, obviously, prostate health is unique to men. So things that men can do, you really want to keep yourself healthy. If you're healthy, it's much more likely your prostate's going to be healthy. So, but, there are many definitions of health. What I'm talking about is good metabolic health with low inflammation, no insulin resistance, um, doing the lifestyle things that you need to do with exercise and sleep. Those things keep us overall healthy, and our prostates like that. They like to be in a healthy body, so they're happier.
Mhm. And are there certain screenings or tests that men should prioritize? Like, what are some hallmark or milestone tests that you recommend men take?
Yeah, so I mean, we were talking about the prostate, so we do recommend them and have a PSA and a digital rectal exam for their prostate when they reach a certain age. You know, I think for most men, age 45, 50 is fine. If there's a history of early prostate cancer, we'll probably drop that to 40. Um, but then, men should be doing the blood work that gives them an idea what their metabolic health is. They should be having, everybody knows about cholesterol, that's pretty standard uh, everywhere you go. But finding a doctor who can look at an expanded panel of inflammatory markers, look at insulin resistance. Insulin resistance precedes prediabetes and diabetes by, 10 to 20 years. So if we can have people become aware of that and intervene in that while they're still insulin resistant, then, there's no reason that they should become diabetic. And if we can
Mm,
take care of that, we can really alter the health of men and the entire country, uh,
right.
for that matter.
And on the topic of insulin resistance, how does diet play a role in men's health? And are there any specific nutritional considerations that you recommend for reducing the risk of certain health issues?
Well, there are all sorts of diets. There's the keto diet, there's the Mediterranean diet, there's intermittent fasting, there's a carnivore diet, there's the Atkins diet. But I think what the healthiest diets have in common is they are low sugar and low carb. Every single one of those that I mentioned tends to have a lower sugar, lower carb load. Some a little bit more than others, but overall, trying to limit sugar and carbs. Even on the Mediterranean diet, if you're eating a Mediterranean diet version, that doesn't mean pizza and pasta all the time. Um, you know, those should be taken in moderation, and those that kind of diet has a lot of high phytonutrients, a lot of fiber, things that kind of complement, um, so that to keep the glycemic load overall low. So I think that's the healthiest, basis for a diet. Now, certain people, you know, if somebody has cancer, for example, then they should be eating a very high phytonutrient diet. They really should be eating what I say the colors of the rainbow every single day if they can, even if it's a small amount, but certainly over the course of the week. And that's really good advice for all of us. I mean, you don't have to have cancer to eat well. Um, but I feel that that's one of the another pillar that I try to tell people about. And then these diets, keto, carnivore, Atkins, I think that those kind of diets, I think, are meant to be done for, in my opinion, everybody has a different opinion, right? You can ask 100 doctors, you'll get 100 different opinions. But in my opinion, those are things that should be done for a limited, period. They shouldn't be your lifestyle, because I think you tend to leave out, vital nutrients, vital phytonutrients when we go on to a more restrictive diet like those diets are. Now,
Mm,
some people who are, diabetic and pre-diabetic, they're going to have to cycle in and out of keto, if you will, at least a keto-ish type diet over a longer period of time to reverse that diabetes. But, really need to do that under the guidance of a healthcare practitioner who can monitor you.
mm. And you also briefly mentioned intermittent fasting. How can that improve men's health or just functioning in terms of preventing chronic disease?
Yeah, intermittent fasting, some people know it as time restricted eating. I mean, the idea there is that that's going to improve your insulin resistance, because if you're, you know, eating, if you start eating at 7 o'clock in the morning and don't stop till like 10, 11 o'clock at night, um, you know, that eating window is, 15, 16 hours long. And then, that time when you're fasting, that overnight fast, if you will, is only like 8 to 9 hours long. That's not enough time often to process all the food that we've taken in, all the carbs that are being converted into, glycogen in the liver and all that. So if we do that kind of thing day after day, glycogen starts to build up in the liver, sugar starts to build up in the liver, and the liver then, because that's toxic to the liver starts turning it into fat. Sometimes it
Mm,
becomes inflammatory fat. Um, but that's the origin of fatty liver. Too much sugar and carbs gets stored in the, that excess energy gets stored in the liver, gets turned into fatty liver. Sometimes that fatty liver, the fat actually becomes inflammatory to the liver, and then people get elevated liver enzymes, uh, can lead to, if that's unchecked for decades, that can lead to cirrhosis, actually,
mm,
known as non-alcoholic fatty liver disease.
right.
So um, I think that, the intermittent fasting comes in if you widen that time window from that 8 to 9 hours to a minimum of 12, and some people will go 14, 16, on a daily basis. you give your body a chance to process all that food, to actually start even, you get into the fasting state in the you're fasting in the morning. You need some energy. It starts to pull stores out of the liver. So it starts to empty the liver out of the carbohydrates. And if you have fatty
Mm,
liver, can help that process of starting to remove that somewhat. Now, some people need even more restriction than that 14 to 16 hours, but that 24, 36 hours, you really need to be under a doctor's care to do that safely, make sure that somebody's monitoring you.
right. So it sounds like in terms of diet, sticking to whole foods rich in phytonutrients, so like your blueberries or your cruciferous vegetables, um, as well as making sure you're having a varied amount of foods and doing it in a timetable in which you're not eating for at least 12 hours under the care of a healthcare provider, is a good starting point and can always be further evaluated based on the individual.
I would definitely say so. Yep.
Wonderful.
Good summary.
So thank you. So when we think of men's health or, a substance related to men, we oftentimes think of testosterone. Can you explain the role of testosterone in men's health and what factors can impact its levels?
Yeah, so testosterone is that, hormone that helps men and women, because women have testosterone also, but, we're talking about men's health here. Helps us build muscle, it helps with endurance. Um, Higher natural levels of testosterone have been actually correlate with heart health, with brain health, with good cognitive function. It helps keep our prostate healthy. So really, it has very far-reaching implications for men. So how do we keep good testosterone levels? Well, really, it's all the stuff that we've been already talking about. In terms of diet, you want to be the more insulin resistant you are, the lower your testosterone levels tend to be. So
Mm,
if you can take care of insulin resistance, your testosterone levels will rise naturally.
mhm.
Um, again, eating those low, hate to keep pounding this point, but it seems like there are people out there who have not gotten this message that they should be eating low sugar and low carb. Um, and hopefully not anybody who was signing on to this, but maybe they know they have a friend or loved one who's not gotten that message yet. But people need to be eating low sugar and low carb. Um, you know, and then the lifestyle is so important. Getting adequate sleep is important. Um, Doing exercise, especially kind of weight training, can
Mm,
help increase testosterone levels. Um, Obesity, of course, that's usually tied in with insulin resistance. But if you talk to somebody in the conventional world, to say that obesity is tied into lower testosterone levels. So, getting to, a more appropriate weight can be very helpful also.
mm. And on the topic of fitness and exercise, you mentioned strength training, particularly what should be like a goal for somebody in terms of strength training. Should they do it once a week, every day? What's considered ideal?
No, I mean, I usually recommend to people that if they're going to be doing more of a full body workout, that they do it twice a week. Some people might choose to break that up and work on one part of the body on one day and then, a different part another day. I don't, I guess what I would caution people against is like doing a full body workout every single day of the week. You need to give your muscles a chance to rest, a chance to, regenerate.
Mm,
If you work them out every day, you'll just be asking for overuse injuries.
right, right. And that could probably cause a lot of stress on the body as well, which would be counterproductive to maintaining healthy testosterone levels.
Absolutely. Yep. Too much physiologic stress would, yes, lower testosterone levels for sure.
Mm. And now onto the topic of heart health, which I know is kind of how you even got into functional medicine in the first place. What are some things that you think that men should know about the heart?
Um, well, the heart is important. Um, yes, so what I think, men should know is that heart disease, despite all our advances, despite all the drugs, despite all the procedures we have, is still the number one killer. So we're not doing a great job in this country for heart health. But I think we can do a way better job, um, not by waiting until we have a blockage and then getting some stents. I mean, that's, you know, kind of the horse is out of the barn already at that point. But certainly we can still alter people's health after that. Um, but I think that, by concentrating on insulin resistance, by concentrating on other inflammatory markers, by concentrating on what I call the hidden risk factors. Insulin resistance is one of those. Sleep apnea is another one. By, lipoprotein A on the blood test, which is not routinely checked for, that's a lipoprotein, cholesterol to lipoprotein, but obviously everybody checks for that. And, people get put on statins for that and lowers that. Lipoprotein A, there really isn't, a great drug for that. Some people we use niacin for some people uh, for that condition. But if you know you have it, then you can do things that mitigate the risk of having an elevated lipoprotein A. So, um, you know, I think you know, I've mentioned sleep apnea already, important that we get enough sleep. So, I mean, it all comes back to lifestyle, it all comes back to diet, it all comes back. But in the case of the heart, there are these risk factors we can assess. We do a special carotid ultrasound called CIMT that tells us the health of the artery wall. It's, different than a typical carotid ultrasound that's normally done. If we thought of the carotid artery as a pipe, on the typical carotid ultrasound, they're looking just to see what's sticking out in the pipe to see if there's a blockage to flow. What we're actually looking for is the health of the pipe, because that tells us the health of the artery, and that now when we know that, we can start intervening and helping people reach their goals of having a healthy heart.
Mhm. And we actually do have a CIMT coming up soon. I believe it's in December. So you could always call our office or email us at info@princetonih.com to book your carotid intermedial test. um,
Um, yeah, it's actually December 6th, so a week from
it's
tomorrow
December
is
6th.
when it is.
Wonderful.
Yeah.
Wonderful. Um, and we have so many exciting toolkits in our office. Like, obviously, um, there's responsibilities in terms of the lifestyle aspects, which you mentioned, diet, sleep, exercise. But sometimes people need a little bit of a help with other things. And we have so many tools in our kit here at Princeton Integrated Health. What would be some things that you might recommend to a patient who's maybe um, dealing with some issues related to men's health, whether it's prostate or heart, anything that you would suggest?
Sure. Um, we'll need a 6-hour seminar for this, but I guess I can just touch on the highlights, if you will.
Hmm.
Um, you know, Hyperbaric oxygen therapy, getting oxygen um, to the heart and to all the tissues, obviously, is a great way to improve heart health, brain health, uh, and actually even lowers insulin resistance. It also helps the body. One of the great causes of aging is oxidative stress that we receive from the environment, from alcohol, from smoking, from the EMF around us, from what we're doing here. All of that, creates some oxidative stress in our body. And hyperbarics can help us raise our antioxidant levels and quench that oxidative stress. So hyperbarics is definitely one that I recommend for people who are interested in true prevention, anti-aging, heart health, brain health, all of that. We have IV therapies that we can do that can help lower vascular risk, things like um, heavy, we didn't really talk about heavy metals but I guess I can mention it now as one of the risk factors, one of the hidden risk factors. The American Heart Association even put out a statement in June of this year titled Contaminant Metals as Environmental Cardiovascular Risk Factors. So things like lead, cadmium, arsenic, and I would include mercury in that category. Um, those metals tend to accumulate in our bodies, and they, you know, cause oxidative stress, and it causes inflammation in the arteries and can ultimately lead to heart attacks, congestive heart failure, that kind of stuff. Um, so we have IV chelation to take care of that. And there are other intravenous ozone is another way to also increase the antioxidants levels in the body and turn down, help quench oxidative stress. And then for people who are insulin resistant, we have the Zerona laser, and it helps people to lose fat, but it also helps as it's doing that, it's helping with insulin resistance. When we check people before and after they use the Zerona laser, the Zerona laser opens up a pore in the fat cells, allows the fat to come out into the lymph and either be burned or excreted from the body. And so people will lose actual fat when they're using that. But really, the thing that makes me the most excited is that when people are checked before and after using the laser, um, their insulin resistance improves, their cholesterol goes down, their fatty livers improve. So it really is a metabolically active laser and helps people move to better metabolic health, which is really what it's all about.
Mm. Yeah, we have so many things, and if you ever want more information about them, you can reach our website, and there's loads on there. But this was a awesome starting ground for those interested. At this point, Dr. Vinny, do you have any other things that you'd like to mention or let people know about?
Uh, we also, we all have stress in our everyday lives. We also have tools that help people deal with stress. Something called the Brain Tap. That's a headset that has light and sound and helps to synchronize brain waves. It can put people. It's almost like a guided meditation. So for people, especially who are having trouble meditating, it's a great way to do it.
Definitely.
So um, there's a question. How do we treat Parkinson's? Treating Parkinson's is a little more specialized, so I would encourage you to call to do a discovery. But the general overall principles are, again, we're looking at diet and that kind of thing, but we're also using some of the tools that we talked about, the hyperbaric chamber. We have a laser that we use for cognitive issues. We look for uh, Parkinson's sometimes is due to toxins. We're looking for toxins that might be contributing to that, and then we use both oral and IV detox methods to help with that. So, that's and always gut health is always so important. So we're always doing that. Uh, so that's kind of the general overview, but we do free 30-minute complimentary discovery sessions. So please call the office, and I can drop in the chat office number just in case you don't have it. All right.
Okay. Any other questions? Okay. Well, thank you so much for joining us today. We loved having everyone here. And of course, if you have any questions, feel free to contact us via the phone or email, and we'd be more than happy to set you up for a discovery call or talk a little bit more about our services.
All right. Thank you, Kayla.
Thank you, Dr. Vinny. Bye.
Bye.